Hello and welcome. Today we're delving into a rare and fascinating heart condition called cardiac fibroma. While uncommon, understanding this disease is crucial, especially for healthcare professionals and families facing this diagnosis. Let's embark on this informative journey together. The precise cause of cardiac fibroma remains somewhat of a mystery. It's generally considered to be a benign tumor, meaning non-cancerous. It's primarily thought to be congenital, arising during fetal development. However, genetic mutations are suspected to play a role in some cases, with research ongoing to pinpoint the specific genes involved. Cardiac fibromas are characterized by the presence of a firm, grayish-white tumor within the heart muscle. These tumors are composed of fibrous connective tissue. The real danger stems from their location and size. They often disrupt the heart's electrical system, leading to arrhythmias. Furthermore, the tumor can obstruct blood flow within the heart, causing heart failure or even sudden cardiac death. The location often varies, but the most common are left ventricle and interventricular septum. Cardiac fibromas are rare, with estimates suggesting they account for less than 0.3% of all primary heart tumors. Because they are congenital, they are most commonly diagnosed in infants and children, although on rare occasions they can be detected in adults. There's no known predisposition based on sex or race, suggesting that anyone, in theory, can be affected. The signs and symptoms of cardiac fibroma can vary greatly depending on the tumor's size and location. Some individuals might be asymptomatic, meaning they experience no noticeable symptoms. However, many develop noticeable signs, including shortness of breath, particularly during exertion. Palpitations, or a feeling of a racing or irregular heartbeat, are also common. Infants may present with failure to thrive, poor feeding, or cyanosis, which is a bluish discoloration of the skin due to low oxygen levels in the blood. In more severe cases, sudden cardiac death can be the first and only sign. Diagnosing cardiac fibroma typically involves a combination of imaging techniques. An echocardiogram, which uses sound waves to create a moving picture of the heart, is usually the first-line investigation. It can reveal the presence, size, and location of the tumor. Further confirmation and detailed assessment are usually obtained with cardiac MRI or CT scans. These advanced imaging modalities provide a more detailed view of the tumor's characteristics and its impact on surrounding structures. An electrocardiogram, or ECG, is also used to assess for any arrhythmias or electrical abnormalities. While cardiac fibromas don't have subtypes in the traditional sense, they can be classified based on their location within the heart and their size. Some are small and relatively stable, while others can be large and aggressively growing, causing more significant hemodynamic compromise. Treatment for cardiac fibroma depends on the severity of symptoms and the size and location of the tumor. In asymptomatic individuals with small tumors, close monitoring with regular echocardiograms might be sufficient. However, for those experiencing symptoms, surgical resection or removal of the tumor is often the preferred treatment. In cases where the tumor is large or located in a difficult-to-access area, a heart transplant may be considered as a last resort. Medications may be used to manage symptoms such as arrhythmias or heart failure. Unfortunately, since cardiac fibroma is thought to be congenital, there are currently no known preventative measures. Prenatal screening cannot reliably detect the tumor. The focus, therefore, remains on early detection through awareness of the potential symptoms and prompt medical evaluation. The prognosis for individuals with cardiac fibroma varies depending on several factors, including the size and location of the tumor, the presence of symptoms, and the effectiveness of treatment. Complete surgical resection generally offers the best outcome, with many patients leading normal lives after surgery. However, in cases where complete resection is not possible, or where significant complications arise, the prognosis may be less favorable. Recent research focuses on understanding the genetic basis of cardiac fibromas and developing targeted therapies that could shrink or stabilize the tumors without the need for surgery. This remains an area of active investigation, with the hope of improving outcomes for those affected by this rare and challenging condition.